looking to treat injuries and manage pain, One Wellness Clinic is taking a unique approach to help people. Greenwich Sports Medicine has helped everyone from Olympic athletes to the average person. Joining us today from Greenwich Sports Medicine are Drs. Gail Chimes and Dr. Christopher Ma. Good morning to you.
Thank you.
We're all debating posture here. We're trying to make sure that we're sitting up straight because that's part of the deal, correct?
One of them.
So tell us how you guys approach injury, then what are you seeing when people come in?
Well, mainly our approach is with sports injuries, and we're seeing a great deal of knee, ankle, shoulder, hip, low back, neck, I mean everything. When we're dealing with sports injuries, we're dealing with most of the joints all over the body.
Now, they say that soccer is very difficult on people.
Sure. It's a repetitive stress. One of the things with sports injuries is that the people are doing the same things over and over again, and that tends to overload the same tissues, the same muscles, ligaments, tendons, so there's a lot of strains to those tissues.
You guys talk a lot about soft tissue. Why is that important?
Chris, do you want to talk about that?
Well, basically, soft tissue, when you think about it, and again, like he said, when you're doing a repetitive motion over and over again in the sport, you're more likely to overload or inflame that tissue. When you inflame that tissue, lots of times you get scar tissue adhesions that build up in the tissue, and that's one of the things we treat. We look to see deficiencies in movement, so we actually might tape them doing the sport, or use a dartfish program, actually tape them doing the sport, see what deficiencies are in the movement they're having, and then actually from there go and treat them.
So when you say tape, you're actually using some high-tech gadgets to really get a look at the motion of these people.
Exactly.
Absolutely.
Tell us also about, you kind of take a holistic approach to things. I noticed on your website you do talk about acupuncture,
Sure.
which is interesting.
One of the big things that most people have, they have two options when they're injured. If they tend to go to the doctor, he'll tell them either A, rest, or B, take a medication. We end up seeing those people who say, hey, I don't want to do either of those things. So our holistic approach is we use our hands, so we do a lot of soft tissue treatments. We might do some joint manipulation, and like you talked about, acupuncture. Acupuncture is great. It works on affecting the nerves, and the nerves are what control pain, so we can decrease some of that pain by using the acupuncture and actually stimulate some of those muscles that aren't turned on. We can turn them on with acupuncture.
And when people leave, it's not just walk out the door and think it's a magic pill. You got to maintain nutrition and other things.
Yep.
Absolutely. Nutrition is, a good portion of the pain process, and especially the inflammatory process. So typically you'll see people, if they come in with an injury, we also want to delve into their nutrition, how they're eating. Are they eating pro-inflammatory foods? So, the proteins that they're putting in or the fats that they're intaking can be pro-inflammatory fats. We want to decrease those, and then we want to give them some nutrients to kind of help decrease the inflammation, help with pain relief, things like that.
And what are some of the good foods to eat if you do want to get that inflammatory stuff to go away?
Definitely just look for things, if you think about vitamin C is something that's a natural anti-inflammatory, so anything with some good vitamin C in it. Then also, really what I delve into is definitely the protein sources that they're putting into, or the fats that they're putting in, because the fats are the most important thing that trickles down to a pro-inflammatory cycle. So, what they feed the chicken, what they feed the cow trickles down to you. So, when they're feeding the cow cornmeal or the chicken cornmeal, to kind of
cow bed.
Yeah, there you go.
So an ankle injury, not just the typical tape it up, let's go. There's a lot involved.
Exactly.
Definitely.
Tell me, are some of these things covered by insurance? How do people deal with that?
Yeah, some of them are covered by insurance. So the other big thing that we really get into is once we fix them, we also have therapy, so we give them rehab exercises, things that they can do so it doesn't keep coming back.
Right.
That's important.
Okay, it's a dual process,
Exactly.
patient and doctor.
Of course.
Thank you both
Thank you so much.
Thank you.
You can log on to our website, WTNH.com, look for the Good Morning Connecticut weekend logo and learn more about Greenwich Sports Medicine.
Thank you.
Thank you. Still ahead on Good Morning Connecticut.